What is your name, your occupation, and where do you work?
Sure. My name is Elizabeth Head. I work at the Georgia Department of Public Health's Injury Prevention Program, and my title is Deputy Director for the Injury Prevention Program, but I also do some grant management for adult driver safety projects.
Awesome. Okay. How would you describe your occupation to someone who is not familiar with injury prevention or public health?
I work in traffic safety. I take a public health approach, which means we look at a population that's vulnerable. In my case, I deal with things that are adults or 55 and older, and they are a vulnerable population. And we work with that population and their families and the professionals that serve them to look at how we can be as safe as possible for as long as possible, but remain independent when we can't drive anymore.
Awesome. So, what are some of your day-to-day tasks or roles in your position?
Sure. So specifically thinking of a grant manager for a Governor's Office of Highway Safety grant, I am planning events. So we have a cool little evidence informed program called CarFit. So we work with communities to assess the ergonomic fit in individual cars. So it's planning those events. It's doing all the administrative tasks that are making connections, building partnerships, nurturing partnerships. It is looking at the latest data as it comes out and is available to see where in the state we want to focus our activities, because everything we do at public health is data driven.
Mhm.
So, it might be that we have more of a higher population of 55 and older in, say, Cobb County or all the way down in Dougherty County. And so we might focus some more of our work in those areas. But we look at the data on a regular basis to help with that. We will look at creating events and trainings for professionals. And then, of course, the usual. I mean, I wear two hats. So my other hat is the Deputy Director for Injury Prevention. And in that role, I'm mentoring staff. I'm providing feedback on their work and their ideas. My basic goal is to make things easier for our staff so that they can navigate just the administrative hoops that anybody has to navigate no matter where they work. And we try to open doors and ease the path for them to do the incredible work that they do, because they're literally out there saving lives. We're reducing risk of injury, promoting protective factors for against injury issues, and saving lives, which is pretty darn cool.
Yeah, that's really cool. That's awesome.
It's
Uh,
fun.
could you maybe give me a couple of examples of projects that you work on more specifically?
Yeah, sure. So, Governor's Office of Highway Safety grant, road safety for 55 plus drivers. That is an annual grant. We apply for that. It's a competitive application. You get invited to apply or reapply. We've held that grant for at least 10 years. I've only been with the department for 7. So, but we do apply for it every year. So that includes the 4 tenets of, well, we call it 5, but it's basically the 4 tenets of highway safety, which is education, enforcement, or policy, because we don't do enforcement in public health, engineering, and EMS. And then our 5th one, of course, would be evaluation. We're evaluating for for impact, for processes and outcomes, which is lovely. So that there's that project that I'm on. I do anything that is related to aging. So I also co-facilitate the statewide Fall Prevention Coalition. And we look for intersections between driver safety and falls. If you're at a higher risk for a fall, you're at a higher risk for a motor vehicle crash. So people think and really believe that driving is an inherent part of their life process, but nobody wants to fall. So I can talk to you about your risk of a fall and then talk to you about how you may be able to drive longer and maintain your independence if we can also reduce your risk of a fall, because there are some cool studies that show a link between those things. So some of the other projects I've been on are writing grants to expand our capacity and our footprint in the state. Every grant that we write in injury prevention, we look for how we can leverage partnerships to make the work go. We look for how we can fund and support our partners and help them with their work. It's something I think that we are particularly good at. So that's a couple of the projects I'm on. I run the Yellow Dot program for the state. Yellow Dot is a communication tool, and we get it into communities, and then it goes in the glove box of their car, and they'll have another packet in their home. And if they have a car crash or a medical emergency, first responders, or we train first responders to know to look for those packets and help them know what to do with that patient or what that patient's wishes might be. So that's another project that I've done.
Oh, that sounds really cool.
Thanks.
What excites you most about your occupation?
Making a difference. I think that sounds cheesy, but it's true. I get to help my colleagues. I get to help the public, and I get to try and make a difference in the world. And that's kind of a cool reason to get up in the morning.
Yeah, definitely.
Mm-hmm.
So we have our certificate program at Emory, the Injury and Violence Prevention Certificate. And the purpose of the program is to enhance graduate education and prepare students to become leaders of injury and violence prevention within their chosen discipline. So what would be your advice to someone who's considering applying to the certificate program?
I think anyone, no matter what occupation it is that they're planning on going into, be it a master's in public health, any other degree, medicine, engineering, the understanding of the burden of injury and violence really can help inform what it is that you do in your work. So for a physician, understanding risk factors and protective factors for a potential victim of elder abuse, or understanding what it means to have a child safely secured in a car seat. These seem like super easy common sense things. They're actually not. If you're an engineer, understanding how to design the roadways so that everybody across the lifespan is safer. That is really important. And to get that certificate, I mean, it's another skill set that you have, and it makes you more marketable. So what I tell my children, I have a student in college and a student out in the workforce. Whether you're working or whether you're getting a degree right now, those beginning steps are a process. Can you finish something you started? And when you're in a master's program, can you do some additional things that show that you have an enhanced skill set and then apply those things in other places? It's a really valuable thing to add on injury prevention, because everyone expects you to do disease, infectious things, chronic things, environmental health, all lovely basic tenets, foundational pieces of public health. They don't expect you to do injury and violence prevention, and yet injury and violence prevention is absolutely interwoven into every other discipline within public health.
If you're interested in applying to the IVP certificate, then email Dr. Dorian Lamis. You can also learn more about the certificate by visiting us on our website or social media.